Call the Senate Finance Committee to order Tuesday, March 26th at approximately 8:40 a.m. Members, today we're going to be working on Senator Rosen's bill, Senate File 751. And we'll be doing, and I might make a note too, members, that we do have a quorum present. Senator Rosen, I understand we're going to be working off of 751 and doing some changes later on in the meeting. So to your bill, welcome.
Thank you very much, Mr. Chair and members. And you have seen this bill before you last year, and I just want to reiterate we're not going to be having any testifiers today because we are working on the finance portion of Senate File 751, which is the opioid response bill. And as you know, I'm not going to go through the whole issue about opioids. It's very, very much in front of us, this crisis that we have. It's a public health emergency. But I have been so honored to work with this bill with Senator Chris Eaton by my side the whole way. And I think we really have a very good bill this year. It is different from last year's bill in the respect of how we collect the licensing fee to pay for the $20 million that we feel is appropriate for the state to work on prevention and treatment and some relief to our counties for out-of-home placement cost. I'm not sure, Mr. Chair, if it's okay to turn it over to Senator Eaton right now for some comments.
Yes, and welcome to the committee, Senator, and also members. Just so you understand, we're working on, you have two bills in front of you. We're working on 751 and House File 400 with the, we'll be having an extra motion at the end of the committee incorporating the contents of Senate File 751 into House File 400. So, Senator Eaton.
Thank you, Mr. Chair. I just wanted to add that I'm very grateful to Senator Rosen, who has done a tremendous job with putting this together through a lot of hurdles. The importance of this bill is that our funding from the feds is unpredictable. They promised us another, I think it was almost $14 million in the state opioid response grants, and now we're down to just over $4 million. And so there's a lot of programs that depend on grants through that, and I hope that this bill will help keep those programs going. And also the issue of the out-of-home placement of a lot of people because of the opioid epidemic. So I am grateful that we're getting this toward the finish line. Mm-hmm. Thank you.
Mr. Chair, too, and
Senator Rosen.
I'm sure Senator Eaton wanted to say this and perhaps forgot. The reason why our federal funding is going down is because we're doing a very good job at stopping the deaths of opioids. Although it has risen, the federal funding is based off the number of deaths you have in your state on opioid abuse and addiction. So with the wonderful work of the Steve Rumler Foundation and many organizations getting Narcan and the work that Senator Eaton does on Narcan and naloxone, we have done an amazing job with that. So we are getting basically penalized. And that's why it's even more important to get some money out. The state has made a significant contribution to this crisis, but this bill is going to help continue the work in that area. I do have some amendments, Mr. Chair, that I'd like to offer to get the bill in the shape that it needs to, and then I can go through the review. That would be okay. I'd like to move the A31 amendment.
Senator, I don't believe they're in our packet, so we'll be handing those out. Senator Rosen, to the 831 amendment, I believe this is the fiscal amendment, I'm being told by staff.
Yes, there is some fiscal ramifications to it. The first major one on 1.4 is $200,000 is appropriated by the commissioner for a program that that works within at least 60 counties of the state addressing the opioid epidemic and they are doing opioid overdose prevention, community asset mapping, education, and antagonist distribution. And frankly, it's for the Steve Rumler Foundation, Mr. Chair and members. They have done an amazing job. A lot of their resources are from fundraising, but they are the ones that have actually lowered or kept our deaths at a minimal compared to the other states. The rest of the bill, we're deleting Section 5, which is on page 17, and we're adding some new language that was suggested by the Board of Pharmacy. And the intent of this language in deleting some old language is to make sure that we clarify the 30-day prescription, that you could still get your 30-day prescription. Refills cannot be, you cannot get a refill until that 30-day prescription is done. And then after the refills are done, there is, you have to go back to your prescriber for more refills. And with that, on line 1.21 of the amendment, we are adjusting it. We have to carry this forward, the cost of this bill, even though it's not in the fiscal note, because it's going to be paid back to the general fund, but we have to carry these costs. And it's going from 2.6 to 2.8 to carry the Steve Rumler Foundation. So that is the A31 amendment.
Members, any questions on A31? Seeing none, Senator Rosen offers the A31 amendment. All in favor say aye. Opposed, same sign. And Senator Rosen, you said you had another amendment as well?
I do, Mr. Chair. Thank you. I have the A33 amendment I'd like to move.
Okay, we're passing that out. Members, the A33. Senator Rosen to the A33.
Thank you, Mr. Chair. This is basically some clarifying language. We have had in the bill, that was an amendment in the last committee, we added intramuscular subcutaneous administration used for the treatment of alcohol or opioid dependence. And NAMI was not very comfortable with pharmacists administrating that, so they just wanted to make sure there's some clarifying language when they administer the intramuscular and subcutaneous drugs for mental health. And they put in some protocol or collaborative practice agreement, and also say that any changes in the drug therapy must be documented by the pharmacist in the patient's medical record and reported by the pharmacist to the practitioner who's responsible for the patient's care. So it's basically clarifying language, some comfort language for people who work in the mental health arena.
And Madam Chair, there's nothing fiscal on this particular amendment. Members, any questions on the A33? Okay, the A33, Senator Rosen offers the A33 amendment. All in favor say aye.
Aye.
Opposed, same sign. Senator Rosen.
Thank you, Mr. Chair. Members, in your packets, there are just a few handouts. And some of you on this committee have seen this information before, but I think it's really, really important to make sure that we are aware of what it's doing to our counties at just the cost, the general cost, and to the out-of-home placement cost. So you're going to have a piece of information from Hennepin County about what it's costing as far as since 2009, Hennepin has seen a 96% increase in child abuse neglect cases involving opioids. 90% of the child protection cases include a parental drug use factor. A decade ago, HCMC would see 6 to 12 pregnant women in treatment for opioid addiction in a year, and last year they would see 6 to 12 per day. Hennepin County spends over $122 million on child protection. $50 million is that for out-of-home placement, and growing at a rate of $6 million per year. This is this little packet that also shows the amount of pounds collected in Hennepin County. And we had Hennepin County testify in the other committees, and that's why I'm pointing this out. But there is you can go to any county in the state, and it used to be potholes, that was their number one issue, and now it's chemical and mental health. That seems to be their biggest cost drivers. Also, a large handout is your out-of-home placement report for each county. Members, you can go through that and see what increases in the services that have been purchased, their average cost per day. So it's very telling. So when I say we have a public health emergency, we absolutely do. With that, I will go into to a summary of the bill. And as I said, the fiscal note has not been adjusted to the amendments that we just passed. But there is an increased licensing fee. Currently, manufacturers, distributors, and wholesalers only pay $235 per year. And you probably don't recall, but last year's bill was a little bit different setup. At one time, we had a penny per pill. Now we went with a $5,000 base licensure fee for all pharmaceutical wholesalers and manufacturers. There's an additional $50,000 licensure fee, so it would be $55,000 total for manufacturers of opiates containing drugs Schedule 2 through 4. Then, if you are a manufacturer who sells more than 2 million units annually, your registration fee is $250,000. So that would be a total what they would pay of $305,000. And the fees are deposited in the opioid epidemic response account that is created. There's reports by March 20th of the manufacturers and distributors to the Board of Pharmacy. There is the Board of Pharmacy evaluates the fee for impact on prescribing opiates during 2020, 21, and 22 with a report to the legislature to determine the assessment by July 1st of 2023. And all this reporting is under the premise of $300,000 going to results first. We need to spend some money to make sure that we are getting the results that we're looking for in this epidemic. There's also a Opiate Epidemic Response Advisory Council that is created. It's 18 members, and that is on page 7 of the members. But it's established to develop and implement a comprehensive and effective statewide effort focused on prevention and education, treatment, innovation, and capacity building. The council shall review local, state, and federal initiatives, establish priorities with consulting with MMB, of course, ensure alignment with federal dollars for greatest impact, and develop criteria in awarding grants. And that is also under the results first. The response account, the opioid epidemic response account, has appropriations, and this is starting on, this is where we get into, this is starting on section 7, page 11, where $300,000, as I said, is appropriated for the results first evaluation activities. $249,000 is for the administration of human services for the advisory council. $126,000 is appropriate to the Board of Pharmacy for the collection of the registration fees. $384,000 is for 3 new BCA agents, drug scientists at the Department of Public Safety. And $800,000 is appropriate to the 2 ECHO programs, St. Gabriel's and Hennepin Health Care, for their Project ECHO, so $400,000 each there. And then the remaining money is split for 50% goes to the social services, to county social services, to provide child protection services to children and families who are affected by the addiction, and that's on page 12, line 4. And Department of Human Services will do a proportional to open child protection case managements in counties from the previous calendar year. We did do some adjustment on that to make it fair that there's just not one county that receives all the money. Then there is, we talk about the first meeting report for the advisory council, and there is a sunset that has been put on. And I feel strongly that we need to have a sunset because there is federal litigation against the manufacturers. And also, there's approximately, I believe, 20 jurisdictions, local counties, some cities that have also filed their own lawsuit against the pharmaceutical manufacturers. So if there is a settlement of over 20 million, excuse me, or greater, the application fee goes back down for everybody to $5,000, and that will sustain the opioid account, and then we'll have some kind of settlement. So it goes into a special fund with that. There's some disposal language that was put in by the Minnesota Pollution Control Agency.
Senator Rosen, before you proceed, maybe I could ask a couple of questions.
Sure.
On page 11, you have 126,000 is appropriated. How many registrations are there in the state of Minnesota approximately? The Board of Pharmacy would have to collect for registration fees. Do you know how many licensed members there are? Are we talking pharmacies now? Is that what we're talking about? Just roughly, I mean, it's just for my
Mr. Chair, if I could
purposes.
bring up Dr. Cody Weiberg from the Board of Pharmacy. I should know that off the top of my head, but
Yeah. Mr. Weiberg, welcome to the committee.
Mr. Chair, members of the committee, I'm Dr. Cody Weiberg, Executive Director of the Board of Pharmacy, and I didn't quite catch the
How many licenses or how many fees would you be dealing with in your department there with regards to the appropriation on line 1122 of the bill? Just an approximate.
Sure.
so, Mr. Chair and members, if you go to page 32 of your fiscal note, the revenues, and thank you, Mr. Albrecht, from the manufacturers in general, there's 811 licensees. From opioid manufacturers, there's 87. From the opioid product registration fee, there'd be 16. From wholesalers, there would be 1,504. From medical gas distributors, there'd be 116.
Okay.
Did you include that too? No.
That's a different.
So that would be
Okay.
what we're collecting.
Thank you.
And currently, as a reminder, they're only paying $235
Right.
to do business.
The other question I had is on page 10 with regards to, social services. 50% would be distributed to county social services. There's some kind of a check system, so these dollars are going to be used for the opioid crisis and not anything else?
Thank you, Mr. Chair, for that question. And, I guess I felt strongly that a child is a child, whether it's suffering from a home that has been affected by opioid abuse or meth abuse or opioid meth abuse or synthetic fentanyl, it needs help, and the family needs help. And I just felt that it would be appropriate for the county to be able to determine where that money goes for those services that that child needs. So it does not say specifically opioid, because meth seizures have gone up 700% in the state.
And it is going to be distributed proportionally to the
Yes.
amount of increases, so thank you.
Yes.
Mr.
On a per
Chair.
capita.
Any other questions so far? Senator Kiffmeyer.
Thank you, Mr. Chair. On that subject, probably the biggest things is one of the questions is going to be, how do we know it's successful? So if we don't have a tracking mechanism for this to be used in the counties, then how do we know that that money is doing what it's supposed to? How do you measure that if you don't tie it in some way?
Senator Rosen.
Thank you, Madam Chair. And Senator Kiffmeyer, we do not have the results first. We don't have any reporting from the counties on whether the money is being used. The state pays very little to the counties for child protection. We don't pay our fair share. Most of it comes from the counties, some from the federal government. And so in the rest of the bill, we use results first for the treatment and some programs. But this one, I just felt, and I have ever since we started working on this bill, that it's appropriate to allow the counties to take care of these children. And do they report to us now of what's happening? I suppose the only report we'd have is from this long sheet of how many children are not going into the system. And, you know, that's about the best I can do. I don't want to necessarily increase more reporting requirements on the county, whether this money is being used appropriately, because I do think they do their very best to protect the children. And I'm a co-chair on the Child Protection Task Force and have been from the very beginning with Senator Sharon when we worked on this. And that's where I've stayed strong on my, several people have been trying to steal that money, and I'm like, but I'm open to suggestions, Senator Kiffmeyer, if you have a suggestion of how you can make it accountable, but I don't know how we can do that.
Mr. Chair, I appreciate that, but I think the results are really what speaks for it. And in the sheet, you know, and some of the information that we have here, there should be some reflection of that, even in something that already exists. So I would just say, though, that the point of spending the money is to have an impact, to reduce, to help, to change. I also think of Senator Abler's pilot project that they did in Anoka County in regards to out-of-home placement, and that was extremely effective with a very small amount of money that included some private money as well. I would suggest that maybe some of those, I know my two counties that I represent, Wright and Sherburne, have been impressed enough by it for them to take a look at what that is doing. And maybe we could talk offline about how to amplify that, but my goal is bottom line, not just putting the money out, but also having it be effective and not just disappear. And so however we can do that, I will leave that to you as the author, but I'll be glad to chat with you afterwards about the Anoka example if you'd like.
Mm-hmm. Thank you, Mr. Chair. And thank you, Senator Kiffmeyer. This is, that's an interesting thought, and I was listening to Senator Abler in committee yesterday about that Anoka program, so perhaps we can continue this conversation. I just felt that the counties spend a lot of money on out-of-home placement, a tremendous amount, and that's whenever you see an uptick in out-of-home placement, you know you've seen an increase in drug abuse in that county, and I know the programs are set up, and we need to support those programs. But I would love to continue this conversation. Thank you.
Senator Hayden.
Well, thank you, Mr. Chair, and Senator Rosen and Eaton. Kind of following that line of question, I think you're right. One of the things that I guess we could continue to talk about is making sure that the dollars get into the child welfare system. And I say child welfare broadly because I think prevention and early intervention is really important too. You know that the Families First legislation that's coming from the federal government is really focusing on that, trying to keep people out of placement as much as possible by doing things like having mothers and mothers and their child to the point practical and possible go to treatment together, or that the children, maybe they're not in treatment, but they certainly are stay with their mothers as they go through that journey. So I think for me the biggest thing is I absolutely agree with you that we need to keep that these dollars need to go there, but I'm hoping that we can make sure that it stays in the child well-being. There is a lot that goes on in the counties that probably they could use some help with, but our ability to really focus from prevention, early intervention, treatment, and then if they do are removed from their homes, supporting those efforts, I think is really important and hopefully helpful with the county doing a deeper dive. For instance, the rates of foster care facilities might be something they might want to think about, but that could suck up the money pretty quickly. So I think our ability to at least understand a general plan from the maybe Max or AMC as to what are the things that they would use, and then some suggestions to them that that they could do to try to kind of help us. I think that that's really important. I absolutely agree with you, Senator Rosen, that that's where the money needs to go. I'd just love for us to really have that rich conversation about what are the things that they were using, what are those best practices that really help these families.
Senator Rosen.
Thank you, Mr. Chair, and thank you, Senator Hayden and Senator Kiffmeyer. If I could ask a question for Ms. Kavanaugh, if we could perhaps strengthen that language, perhaps not right today, maybe on the floor, and have that discussion briefly, to make sure that there is some accountability in that paragraph. I do believe that's fair. It's a legitimate concern. I do have faith that the counties are using any dollars, more dollars than they have to protect the children. But if that's what we need to do to strengthen this, of course, this bill is going to be worked on for years too. There's a lot of moving parts in this bill, but I absolutely would be acceptable to making sure that this language is as appropriate and strong as can be. So, Ms. Kavanaugh, if we could work on that.
Senator Eaton first, and then Ms. Kavanaugh.
Oh, she can respond.
Okay, Ms. Kavanaugh.
Mr. Chair and Senator Rosen, certainly we can look at that and figure out, talk to the right people in terms of how we actually do measure that and report it and what makes sense.
Thank you.
Yeah, Senator Eaton.
Thank you. My hope is some of this funds in the counties will be used. For instance, HCMC has 6 to 12 babies a week that come in opioid dependent, so that we could use some of this money to help the mother get them into treatment on a medication, and so they can stay together. And it's a crisis. I mean, it needs to happen, and I think this will be valuable, this funding, for keeping families together.
Okay, any other questions so far? Senator Rosen.
Thank you, Mr. Chair. Then after the disposal language, we have the general prescription requirements. Just briefly, no prescription dispensed more than 30 days after a date prescription that has been issued. Additional authorizations, and that was the amendment that we just passed to make sure that we get that right. These requirements are for acute pain only, members, and I really want to stress that. It's not for chronic pain. So the acute pain requirements shall not exceed a 7-day supply for adults and 5 days for minors. And it also deals with a dental issue too. Some people were getting extractions and a 30-day supply of opiates. And the reason I want to clarify the acute versus the chronic is because in the language, and that is page 17, it specifically, no, excuse me, it's not page 17 anymore. It's page 19. It specifically says that a professional clinical judgment of the practitioner may be used. So that's the standard of care. And if someone's in chronic pain, we allow the prescriber, the professional, to use his own judgment. And that is that's why we have the support from MMA and all the other associations. There is some accessing the data for the prescription monitoring program. Before you schedule a 2, 3, or 4, there must be access to data. You must go in and issue that. Now, there has been reports in the past that that system has been clunky. It's getting better, from what I understand. And we need to be able to share so we can stop doctor shopping. That's what's been going on. At least every 3 months of patients receiving opiates for chronic pain or participating in the medically assisted treatment program, they must access the data. This does not apply to access to data if you are in hospice or palliative care, treated for pain due to cancer, if you have a dosage of 5 days or less and no refill, or if you have an ongoing relationship with the patient and provider which is longer than 1 year, the prescription issued within the 14 days following surgery or 3 days oral surgery. It does not apply if the patient is admitted to the hospital, if it's been lawfully administered by injection or ingestion. You don't have to access the data if it's due to a medical emergency or you're unable to access due to a system failure. And then we go into the funding of the PDMP, which begins July 1st, 2019. There's an annual fee or prescriber for the pharmacist, and the prescriber of $50 per user, which will go into a special revenue fund for the board to authorize the vendor. There's also continuing education of 2 hours, at least 2 hours of credit, which goes on the fiscal note, members, it's for, you can see on the front page, it's for nursing, optometry, pharmacy, podiatry, and that's about it on that one. And then we have Senator Abler's alternative pain management language. And Senator Limmer, the $2 million, this is on the very last page, or actually page 26. There's $2 million per year from the general fund, my commitment to you, for an increase on the violent crime enforcement team grants for prioritizing in greater Minnesota, because right now we have 21 teams, and the greater Minnesota teams do not become eligible for the HIDA grants for continuing funding. They have not seen a funding increase since 2011, and they need to be able to, this is part of the prevention. We have synthetic fentanyl, we've got heroin, we've got meth coming up our highways and our interstates, and illegal opiates, and we need to stop that. And then we also have $244,000 appropriated from the general fund for a one-time information technology and operating costs for admin of the licensing activities, and $500,000 to the Board of Pharmacy for additional revenue for their operations to help with this. So that is the bill, members, and you also, I'm dealing also with the summary of appropriations, this piece here, and it basically goes through what I just mentioned about spending. With that, Mr. Chair, I am open to questions. Senator Eaton, aye.
Senator Limmer.
Thank you, Mr. Chair. Senator Rosen, I want to thank you for recognizing the need on the second to last page regarding the violent crime enforcement teams. We have those in Minnesota, and the name is kind of a misnomer. Violent crime covers anything dealing with illicit drugs and drug trafficking in the state. I've noticed in the last few years that there doesn't seem to be a lot of news headlines regarding illicit drug trafficking in the state of Minnesota. And quite honestly, it's the best kept secret in the state. And as evidence of, and we're beginning to see it, we're beginning to see the headlines, it seems like it's once a week. There's a car or a truck that's pulled over on a routine traffic stop, and there's literally hundreds of pounds or hundreds of thousands of dollars of illicit drugs somewhere hidden in that car. When I've asked law enforcement in the Judiciary and Public Safety Committee, I have made it a habit of asking our law enforcement people whenever they're in front of our committee, where do illicit drugs come from? And it is a constant, continuous theme. They're coming from south of our border, and they're coming up through a myriad of road routes coming through the United States, all the way up to the most northern state of Minnesota, which is really quite remarkable. But it does emphasize, and if there's, for any other reason, there's a need for better security on our southern border, illicit drugs is the reason. And I'm glad that you've recognized the need to not only address opioids, but the illicit drug traffic in this country, as well as in our state. And the trafficking seems to come up through rural areas. And I noticed that on line 26.5, the commissioner must place a priority on funding non-metro teams. And as far as I'm concerned, let's give law enforcement the tools and wish them happy hunting, because these people need to be, they're bringing in poison to our kids. They're bringing poison to our schools and playgrounds, not to mention other areas of our culture in the state of Minnesota. And I'm just grateful that you're recognizing not only the opioid problem, but also the illicit trade. I did have a question going back on the other side of your bill to page 2. And these are the sources on lines 5 and 6, page 2. I see that most of these increases in fees are toward those that manufacture opiates. But I was curious about lines 5 and 6, where it's a non-opiate legend drug, and they're getting the same treatment of up to a $5,000 fee. And I was wondering, why are they being targeted rather than the opiate producers? Or are these the same drug manufacturers? I don't know.
Mr. Chair, thank you, and thank you, Senator Limmer. To me, Senator Limmer and members, I feel that $235 per year to do business in Minnesota is a heck of a deal, and they have been getting a heck of a deal. And Senator Draheim has told me that to get a liquor license in downtown Minneapolis can be up to 30 grand. So to get to our 20 million that we were committed to, not more and not less, we have been committed to 20 million because we felt that that's what we needed to say. You know, everybody can come to the table and be a part of this. We needed to include all drug manufacturers. And you can see the list across the nation of what other states are proposing and what they charge. And it is, you know, it's, I don't think it's out of line for $5,000 to do business here in Minnesota.
Well, Madam, Mr. Chair, Senator, you know, I'm a realtor, and to be a real estate agent in this state for 1 year, it's roughly $130 to have a license to do business in the state of Minnesota.
Oh, 1%.
And most realtors don't make a lot of sales. They a lot of part-time people in it,
Yeah.
seasonal people, retired people. But there's also some people that can make a lot of money due to their ambition in that business. But when you compare one real estate license for around $100 compared to a multi-million-dollar operation that's selling high-grade drugs, $235 is basically free. And I'm glad you're bringing some proportionality to the business.
Mr. Chair,
Senator.
Thank you, Senator Limmer. This has been, as you know, an extreme challenge to get this maybe a little more equitable or fair, and I think we have hit a sweet spot. Nobody's going to like it. Nobody likes it, but they're not complaining as much as they are about the House bill. and I think we spread it out all across the board. So, as I said, we've stayed there. There's no desire to go above 20 million. There's a lot of things in play, like a federal lawsuit, and so this is something that we needed to say. Yeah, you need to come to the table, as I said.
Senator Limmer, follow-up?
Yeah, one last question, Senator. The drug manufacturers, are they like others in the healthcare industry? Are they a non-profit organization? Do you know? Or are they a for-profit?
A for-profit.
Senator Rosen.
For-profit.
Mr. Chair, thank you, Senator Limmer. They got another for-profit.
All right.
To that point, or several points that Senator Limmer made, I do want to thank you for working with the enforcement. You know, the amount of work that you did, and you should be commended for it on the homemade meth some years ago. Basically, your legislation and others stopped that, but unfortunately now, as Senator Limmer said, we're getting crystal meth coming from the southern border, which is a better poison, whatever that means. It's just a quicker, better poison, and I don't understand that description, but I know it's very strong. And just a point of interest to $2 million. There was a recent drug bust in my jurisdiction, or my district, on the freeway, where there was enough drugs there confiscated for a street value of over $4.5 million just within the last 3 weeks. So, and Senator Limmer's right, that doesn't get publicized well enough. There's a lot of good work going on out there, and unfortunately, we're just, I think, just skimming the top of it. So, Senator Kiffmeyer.
Oh, thank you,
Senator Hayden was first. I'm sorry. Sure.
Well, thank you, Mr. Chair, and Senator Rosen and Senator Eden, thank you. We've been together on this bill for a long time. I serve on all the health care committees with the both of you, and I really do thank you for kind of bringing this bill and getting it there and kind of getting it as close to the process, or getting it over the hump as we can. I too am really glad that you're putting some strengthening on the law enforcement side. Not only has it been happening in the rural areas, but many of you know that the homeless encampment that we all saw this summer is in my district, and we've had multiple overdoses just there, and that's just a microcosm of what happens in the Little Earth community, the urban Indian tribal housing community. Often they would have 10 or 15 overdoses per weekend. That's what they could count. And sometimes it's hard to count because law enforcement would show up for one, or EMS would show up for another, or frankly getting the lock zone. Thank you, Senator Eaton and Rosen, for helping with that it would go unreported. However, nonetheless, those overdoses were happening. As a matter of fact, inside of Little Earth, a story is young people as young as 4 and 5 and 6, 7 years old are being taught that if they come home and their parents, their mother or father, are unresponsive, to go to the unit that has a purple ribbon, and that's where the person who's trained in using Narcan and naloxone to come in and to help. So instead of coming home and having a snack and doing your homework, you kind of check on your parents and you go through that protocol. And so think about what that means to a young person. So, we have these stories all over, and everybody does, but just to kind of bring that home, that's the issue in those, in these drugs, and now fentanyl and others laced in any delivery system you want. Is prevalent there. They call it the pink stuff, is what they told me when I walked around there. I don't know if that's just a chemical mixture. Maybe Dr. Weiber can tell us what that means. But that's what's going on, and so we need continued enforcement. I really appreciate all the work on recovery and recovery services. I know medically assisted treatment is something that is really effective for a lot of people. So our ability to kind of hone in on that and make sure that people are being treated is really important in this bill. And then the last thing, Senator Rosen, we've talked a little bit and still trying to work. I was just reading an article that, I think I sent it to you, that fentanyl use in the African American community is up 141%. And so just for context, the opioid process, or the opioid crisis, has been in the African American community for a very long time. Even to the point that it's got institutionalized, and people kind of got their street drugs. They knew what it was, and they knew how to take it and function. Not that that is a good thing, but that's what happened. But the advent of fentanyl and other synthetic drugs has kind of thrown that off. And so people who were kind of managing, outside of kind of the normal spectrum of trying to deal with this are now, overdosing at a rate that is much larger than before. So I just want to bring that to light, because I think that often people don't understand it. I know, for instance, when I was on community radio and I started to name all of the various opioid kind of drugs, a lot of people in the community didn't know. You didn't say it was that, they thought that was something else. So bringing awareness is really important. And with that, I want to still continue to work on, with the author's permission, as we go through the process of either ensuring in the task force, or, I know that there's some trouble about getting adding, but that, we don't want the group to get so big that you can't get your work done. But some assurances and some ability for us to know that that there'll be task force members in the African American community that is able to bring that voice to the table when we're making decisions on where resources should go. I think the Steve Rumler Foundation does phenomenal. We've started, I was there when they started in the compelling testimony, but also ensuring that if we're allocating and carving money out to groups to do good work, that they would in turn have the cultural competence to make sure that they're there. And I'm not suggesting that they don't, because we haven't had the conversation, but just having those conversations so that we don't miss this group. I think the American Indian community is well represented there, and we've talked a lot about that. But just making sure we don't miss that, because the numbers, as they're starting to slowly dip a little bit because of work, that doesn't seem to be happening in the African American community. So I just want to make sure that our eyes are really focused on that, and that we don't come back here 2 years from now with the unintended consequence that we missed this community. So with that, Senator Rosen, I don't plan to offer anything, because I think you and Senator Eaton have worked too hard on this bill to have us start to do policy on the floor. But I would hope that we would, or in the committee, but I would hope that we would continue to think about that on a Sterney Conference Committee, the floor, and others, to ensure that community interest is there, or the eyes of someone who understands that community is thinking about it as we implement it.
Mr. Chair.
Senator Newman, then Senator Kiffmeyer.
Mr. Chair, if I could respond to Senator Hayden, and thank you, Senator Hayden. Yes, we have had this conversation, and I really do appreciate it. I'm trying to figure out, I don't want to go above 18 members, but in my honor, I will work on this in conference committee, because it has hit the Native American and the African American community disproportionately hard, and Greater Minnesota also. But that, I do believe there should be somebody on here. I just can't quite figure out exactly who I'm going to displace, because we had to deal with the chronic pain issue, and we wanted somebody on there to make sure that there's comfort knowing that their drugs aren't going to be taken away. But I know there is a great desire to have that representation on the board, and I will continue to work on it.
Senator Eaton, to that point.
Thank you, Mr. Chair. I've also initiated a conversation and plan to have another one with the DHS commissioner, who would appoint the majority of the council. And I mean, as far as I'm concerned, the majority of the members can be people of color. I mean, as long as they meet the criteria, we could have somebody in chronic pain who's African American or who's whatever. I would expect it to be diverse. I mean, I would be very disappointed if it's not.
Senator Newman.
Mr. Chairman, a comment and a question. First of all, a comment. I want to express my appreciation to Senator Eaton and Senator Rosen. I have not spoken on this issue to date, and please don't take my silence as being disinterested. It's simply that without you having brought this forward, I would not have known anything about it. And that's the appreciation that I want to express. Is I've been sitting now for 2 years listening, and believe me, you now have my attention. And I want to support as best I can your efforts as you move forward. Now, my question. There's a letter in our packet from the Americans for Prosperity signed by Mr. Flores. And in it, he is saying that punishing Minnesota patients by making them pay more for their care and medication is not the answer. Now, if I read between the lines, what is being proposed here is that the pharmaceutical companies are proposing to pass on to the patients the $20 million licensing fee that you are proposing. I think that's what is being said here. Senator Rosen, could you put into perspective for us a little bit, if you could, the disparity between the revenue raised by the pharmaceuticals in comparison to the $20 million licensing fee that your bill is proposing?
Senator Rosen.
Thank you, Mr. Chair, and thank you, Senator Newman, for that. And that is a question we have debated all along. It's hard to get your hands from DHS or from the county level of what this is costing the state, but you can imagine what it's costing all the way through our state programs, down to the county, down to just personal lives lost, down to the hospitals, the uncompensated care in the hospitals. They have seen ER visits increasing 16.2%. And of that, 75% of it is all mental and chemical health. So the disproportionate abuse of the system because of this epidemic. And you've got these manufacturers who there's some real bad players at the very top that have been pointed out, that have and they've done some misinformation to the prescribers. They have said it's not our fault all along. And finally, everybody is waking up and saying, this is what happens to opiates. You can become addicted at a very early stage, possibly, if it's not monitored by a physician. It has to be monitored. So to answer your question about their funds, I mean, I used to, in my previous testimony, I would talk about their gross revenues, and some of these manufacturers and distributors, billions in fourth quarter. Some of the generic opiates have questions of that because they say their margin is so small that they aren't making those billions. But I still say that if you are in this business of opiate distribution, manufacturing, you have a price at the table for this abuse and misinformation to the general public. And you have a responsibility to those families and to the lives that have been lost, and to the states. So I'm not sure if I'm really answering your question as well as I'd like to, Senator Newman, but I feel that there is a responsibility here, and everybody is coming around to the table with this bill. There is obviously a cost, and we are asking very, very little from these manufacturers and distributors to be at this table. There will be a federal claim. There is a lawsuit right now, and there'll be a, what do I call it?
Settlement.
Settlement, thank you. A settlement on that, and that it could happen anytime, just like the tobacco settlement. And we've got language in here to adjust to that. So we're not trying to penalize anyone, but we are saying this is what you owe us, because we have put skin into the game also. The state, the counties, the doctors, the prescribers, the treatment communities, they've all been to the table. So you need to be to the table too. And that's why we have that licensing fee increase.
Senator Eaton, to that point?
To that point, I'd also like to add that all of these pharmaceutical companies recently got tens of millions of dollars in tax breaks from the federal tax plan that just was passed. And I didn't notice any of the drugs prices going down. So there's a, whether they'll increase their prices or not because of this bill, I do not know. But I think it's a drop in the bucket in their funding.
Senator Newman.
Thank you, Mr. Chair. Senator Rose, just a real quick follow-up question to the issue of passing the licensing fee on to the patients, to the consumers. And, you know, given the volume of revenue generated versus the comparison, the proportionality of the licensing fee, do you have a position or an opinion or a statement as to whether or not it would be responsible on the part of the pharmaceuticals to threaten to pass this $20 million on to the patients?
Senator Rosen.
Thank you, Mr. Chair and Senator Newman. That's a conversation I've had in my office privately with them. And that's why we have the Drug Pricing Transparency Act bill that is marching through. In fact, it's being heard today, is we want to know why you are passing these costs on, whether it's opiates, whether it's insulin, whether it's any medication. Where is your price increase coming from? Now, just a little past history, New York had passed a bill similar, not really, but similar to what we did, but they generated 100 million. We're only generating 20 million. But they said in their language that you cannot pass the cost on to the consumer. That was appealed, and the courts ruled with the manufacturers. We've never had that language in these bills for the last 2-3 years. But my challenge to them is, shame on you. Shame on you if you pass this on, because you are making millions, billions of money. And the thing that people don't understand, too, is the distributors and the wholesalers, they're also distributing the treatment, the Suboxones, everything else for this epidemic. So they have a full circle, a full plate of all these drugs that they are distributing, not just the opioids. So they want to just focus on the small margin of profit on opiates, the generics, but look at all the other drugs that they are, that support this epidemic.
Senator Kiffmeyer.
Thank you, Mr. Chair. So on kind of that topic, which was something that I was thinking about as well, but I've taken a little bit different approach at taking that $20 million and taking the quantity sold in Minnesota, and that you might be able to come out to a calculation of what it is per milliliter, milligram, pill, so however you want to, and we can kind of reverse engineer, you might say, what that might be, rather than trying to get at the profit thing. Just a thought for, because I think it is an important question to have an answer for, and I appreciate this discussion. The other thing, I also appreciate the $2 million for the law enforcement, but I think for us to understand, this bill primarily deals with the legal prescription and the leakage into the abuse or the misuse of what is a legal substance, okay? The illegal, and the question is somewhat, what is the percent of those that are into this opioid addiction versus a legal prescription versus the percent that get into this by illegal drugs that come in a different way? Do you have a sense of what that ratio might be? Because the one we really have the greatest control, and the saddest one, is when you've prescribed something thinking you're doing good and it ends up doing harm, or because it's sitting in the cabinet and kids got into it, does harm. We recognize that. That is something we actually, each of us individually can go home tonight. We can do something about this ourselves right now. When we go in for dental care or different things like that, we individually can do something about that right now, okay? Not just leaving it to the providers or anybody else, but that we can actually have the empowerment to do that. And so I respect what we've done, recognizing if the largest percentage of problems are coming from illegal, then this $2 million is also extremely important, but I come back to the same thing. How do we measure, do we have an overall annual estimate of how much illegal is coming into Minnesota? How much do we capture and destroy? I mean, it's really hard to solve a problem when you can't really get your hands around it. But we've got to, or we never have a sense, because I hear about this year and year upon year, and it just seems to be getting worse. A little bit of frustration about that. I get it. We're doing something about what we can control, and was within that. But those are, if you would just like to comment to those things that I've mentioned, both whether it's the measurement of the cost per pill on our own or legal, illegal, et cetera.
Senator Eaton.
Thank you, Mr. Chair. Senator Kiffmeyer, I want you to know that 4 out of 5 people who use heroin in particular started on prescription pills, prescription opioids. And they may not have had them prescribed legally. They may have gotten, like you said, from somebody's medicine cabinet or whatever, but they started on prescription pills. And even though the prescribing rate has gone down, the number of people using and overdosing has gone up. And so people still have them in their medicine cabinets. People are still not disposing of them when they're not using them. I had the argument with my aunt the other day. What if she needs them down the road? You know, I might do something and need a pain pill. You know, that's how people get a hold of them. Mm-hmm. And when people are doing home robberies, that's where they're going. They're going straight to the medicine cabinets.
Mm-hmm. And Mr. Chair, to that also, just a few facts that I did not mention, but I think are really important. In Minnesota in 2016, so this information's old, 3.5 million opioids were prescribed. There's over 2 million people in the United States with a opioid use disorder. Now, as of a month ago, opioid overdose deaths have surpassed car accident deaths. And deaths rose 26% between 2016 and 2017. And for every one opioid overdose death in 2017, approximately 5 emergency room visits for an opioid overdose. Our hospitals have just been hammered with this. So it's really hard to measure the illicit versus but I can tell you the waste collection in Minnesota, this is from the Minnesota Pollution Control Agency, this just blows my mind. From 2007 to 2017, 175,000 pounds were collected in 2017. In those 10 years, 600,000 pounds were collected of unused, unwanted prescriptions. And if you don't think we have a prescription problem in the state, that's 600,000 pounds divided by 2,000. That's an unbelievable amount of drugs collected. So we have a lot of work to do.
Mr. Chair, just in a follow-up.
Sure, follow-up.
I think that the answer to the question that the prescription drugs and the addiction thereof leads to a demand for the illegal is probably one of the better pieces of information that I find, really, really helpful. But the other thing is, it's interesting how effective that has been through collecting and having those collecting points. I would suppose in your bill or elsewhere, maybe, or in your bill, the public education campaign for people to do that. I know that on Facebook, I've been having people asking questions, and it's breaking into that area of where do we go to dispose. And the problem we're running into when you have a Schedule I controlled substance, there are certain places that ordinarily might take regular prescriptions but will not take a Schedule I. I've been talking about this with my counties as well. And so that's an area that when we work on this, we recognize that make it easier for people to do that and inform them of the connection between legal to illegal. But I think especially, I'm finding it in my counties anyway, the Schedule I, the repository of prescriptions, they do not want narcotics, opioids, or those things going into that. And maybe that's a misunderstanding or clarification, but it is something, again, that's within our power that maybe within your bill is included. I just didn't see it specifically.
Senator Eaton, and then we're going to go to
I just wanted to add that a couple years ago, I did pass legislation that allowed pharmacies to take back controlled substances and dispose of them. A couple pharmacies, the bigger ones, Walgreens and CVS, said they were going to start doing that. I think there's like 4 or 5 in the state, but I'm kind of disappointed because they made it sound like they were going to do it in all of theirs. But I'm hoping more pharmacies can do that, and maybe we need to look at subsidizing some of the smaller ones in greater Minnesota so that they can afford it. There's an expense to having them sent somewhere to be burned, basically.
Mr. Chair, and to that point, Senator Kiffmeyer, if you'll take a look at page 16, Section 3, talks about expansion of what it's the requirements for law enforcement on the program, the medicine disposal program, and the public education information and making materials available. So there's, yeah.
Senator Marty.
Thank you, Mr. Chair, and to the authors. You put together quite a system for how to distribute all the funds for enforcement, for child protection, for CD treatment, everything else like that, and allocated much of the amounts and then left the rest of the council. And then there is something that I think you know is going to happen. There's going to be a settlement, and supposing it gives $21 million. I think with one or at least one of these companies, it should be in the hundreds and hundreds of millions that Minnesota gets. But, you know, let's say it's 21 million or 30 million, just with one company even, any settlement, and the whole thing crashes down. It says March 1st, they're supposed to tell the manufacturer, March 31st, they're supposed to tell them what their distribution fee is and so on. And supposing a few weeks earlier, there's a settlement. All this comes crashing down, and all of a sudden nobody gets any of the money for law enforcement, for the pharmacy, for the child protection, and then, but we can revisit it. But you just spent 2 years trying to get this. There's a little settlement, and a settlement for wrongdoing, and all of a sudden you're going to say, well, we're going to start over and we'll try and put this back together again, and I just don't get that. I think you put together an excellent bill, but you're saying, oh, all there needs to be is one settlement with one payout, one settlement, one whatever judgment from any lawsuit in which Minnesota is a named party, in which we get payout of 20 million or more, which is 1 year of this stuff. And you're going to shut the whole thing down saying, well, of course we can revisit it. And I just don't get why you would put yourselves or us or most importantly, all the people who are depending on the money, because I think we can argue if it's the right amount of money or not, but I think that every one of the folks you're giving money to, you'd rather give more to, and saying we're just going to pull it all away. And because the way I read the language in Section 9 of Article 1, it seems to me that that money is deposited in the general account, and you notify us, and all of a sudden, again, depending on the timing of the year, it could happen in February, March, or shortly before all the payments are made. And the next week, everything everybody's been planning on, counting on, is gone. And I just, that doesn't make any sense to me.
Senator Rosen.
Thank you, Mr. Chair, and Senator Marty. This is an area that has been difficult to get our hands around. This is an area that will, as you suspect, be part of negotiations in the conference committee. But it is important to me. It's important to my caucus members that there was some kind of chance to relook at the monies that are coming in, the agreement that is coming in, if there is a federal settlement. And even if there is, everybody still has to pay $5,000. So that's an ongoing licensing fee. But I think it's important because I wanted to make sure that it's not a bill that's continually penalizing the manufacturers and distributors. You know, the federal courts will bring them to judgment, and we'll have to see what happens at that point. But as I said, it's important to the colleagues in my caucus to keep that. And it's probably not appropriate to say that online, but that is important to have this.
Senator Rosen, too, you may make a note on page, Senator Marty, page 26, the section 12. Those dollars are from the general fund, so those will not go away. Is that correct?
Yes, Mr. Chair, thank you. That is a good point, that we continue our state commitment by and then now it's not 2.6, it's 2.8. It's appropriate from the general fund to make sure that the programs are sustainable and ongoing, the ECHO programs and Steve Rumler.
So,
Mr. Chair, Senator Rosen or Mr. Chair, the appropriations will be ongoing to these funds, I mean, or to the list of appropriations here, but the funds to child protection, county child protection, and the council, that's all, the bulk of the money is all gone.
Right, right.
I would just make an observation then that when you're meeting with your caucus, that that at a minimum, what you do is say, if money comes in from the federal government in a settlement, we can figure out what happens, but at a minimum, continue this funding for a year or two. So you have time to not cut it all off and not drop everything in the middle of it. I just keep picturing all the child protection programs that you've sent half the funds to, the CD treatment programs and everything. Instead of cut it off and say we can bring it back, at least give a year's time for us to avoid it. So when you're talking with your caucus, I strongly urge that, and in conference committee, I'd urge you to lose the whole thing. Because I frankly think that money is supposed to be a settlement for wrongdoing. Many of the ways you talk about that this is a reasonable way of doing business to make sure that they're paying the costs of any potential harm they're doing. A settlement in that lawsuit is for wrongdoing and for misbehavior, behavior that's killed hundreds and hundreds of Minnesotans. And to me, that should be totally unrelated to this. That should be a settlement for, or a lawsuit judgment for the harm they've done, not for their doing business. So I strongly urge you, at least so you don't cut off the programs and everything in the meantime, to continue it for a year after the settlement and giving us time to reconsider.
Thank you, Senator Marty.
Senator Rosen, I understand if it's a settlement that there's still going to be X amount of dollars that are going to be going towards child care into the counties out of this particular bill.
Right. Exactly.
Is that
yes,
correct?
Mr. Chair, thank you. Yes, it will. The settlement would, I believe, and correct me if I'm wrong, Mr. Nelman, but it would be in the special revenue account, and it would be appropriated by the advisory council.
Okay, members, any other questions? Any other comments, senators, before we move?
Mr. Chair and members, I'll let Senator Eaton go first if she has something she'd like to say.
Thank you.
Senator Eaton.
Yeah, go ahead.
I'd just like to point out that from the kind of guesstimates that an organization put together, it's costing the state of Minnesota about $5 billion a year if you take into consideration lost wages of people who died, law enforcement, hospitalizations, EMS, and so on. And so at $20 million, it would take 200 years to make up 1 year's worth of loss to the state. And most of those funds came from people's property taxes and counties' funds, because that's where the counties get their money. So this has been not only a devastating crisis for families with people with addiction and with deaths and so on, it's been a financial devastation. And also these people can't, a lot of the people who have addiction aren't working, and we have a worker shortage. So it's hitting our workforce and it's hitting our economy. So I just see that, as Senator Marty said, that this is a wrongdoing they've done. I mean, as someone who lost a loved one, I can tell you it changed my life forever. My life will never go back to how it was before my daughter died. And the stories I hear every single day, I got calls from Lexi Reed Holtum from the Steve Rummer Hope Network that she knew of a couple overdoses this weekend, and thank God they had one of the kits on hand and were able to reverse them and save their lives. And it impacts you when you know the people and you know that that could have been another loss in that family. So I hear them. We lose around 10 to 14 people every week in Minnesota, and I hear about a half a dozen of them contact me, the families do, because they just want to do something. Their hearts are breaking. They want to do something so that nobody else has to go through it. And this isn't over. I mean, because we're all talking about it, people think it's getting better. It's not. It's, in fact, on the illegal market, they're creating pills that look like prescription pills that have fentanyl in them, and that's how people are also dying now. People think they're buying the Percocet that they were getting from their doctors, only it's got a high dose of fentanyl in it, and they're overdosing and dying. So that's what happened to Prince. And after this actually started 3 years ago, Senator Rosen took it on as a champion a couple years ago, and it's been a wonderful partnership, and I'm very, very grateful. Thank you.
Thank you.
Mr. Chair, and very, very grateful to work with Senator Eaton. I just want to say that this is tearing our families apart, and Senator Eaton said that very well. It's not a partisan issue. This bill, frankly, is a leap of faith. We are embarking on something that you could tear apart. You could shoot some holes through it, but it's the right thing to do. It's the right thing to do to bring everyone, as I said, to the table and make everybody accountable. And that's what we're hoping to do.
Okay. Thank you to the two of you. These are tough issues to deal with, and we are stepping up. The legislature is stepping up thanks to the two of you and the work that you've done. Members, any other questions? Seeing none, Senator Rosen moves to delete the contents of House File 400 and insert the contents of Senate File 751 as amended. Any discussion? Seeing none, all in favor say aye.
Aye.
Opposed, same sign. The next motion is Senator Rosen moves that House File 400 be recommended to pass as amended and placed on the general orders. Any discussion? Seeing none, all in favor say aye.
Aye.
Opposed, same sign. Thank you.
Thank you so much, Mr. Chair. Thank you very much, members.
Thank you.
That concludes the business for the day. It looks like we'll not have to meet tomorrow, so our next meeting will be Thursday with 2 bills on the agenda.
Great.
So-
Thank you.
We are adjourned. I'll adjourn again.